We're here with Dr. Jeremy Metzler talking about concussions. Dr. Metzler, what are some of the most common symptoms one would have if they suspect they or a loved one had a concussion?
So typically the most common symptom is headaches, but there can be a lot of other symptoms associated with that. Irritability, changes in mood, sleep disturbance, appetite changes, all those things can be signs of a concussion.
And when should someone seek medical help?
The recommendations are to seek medical help anytime you have a concussion in order to get back into full activity. And that could be anybody that is comfortable seeing concussions and clearing concussions.
And what is the evaluation process for someone who's had a concussion?
So it really depends on if they're still symptomatic or not. If they're still symptomatic, we tend not to put them through a lot of exercises or tests just because it can make those symptoms worse and doesn't really help us decide how to treat. If they don't have any symptoms, then they typically go through a cognitive testing and balance and proprioception testing as well.
And for someone who is suffering from concussion symptoms, what treatment options do we have for that?
Yeah, so a lot of it depends on what symptoms they're having. If they're more migraine type headaches and headache type symptoms, we can treat appropriately with anti-inflammatories and those types of things. If it's more dizziness or vestibular, we have specialized therapists that we can send to and have evaluated. Some people have more cognitive or memory issues, and we also have special therapists that can help with that as well.
And if someone has had multiple concussions, how many is too many?
Yeah, that's really a loaded question. There's really no number of concussions that's too many. There's a lot of factors that play into that. The number does play a role, but also how severe are the concussions when you get them, how long do symptoms last, and really the biggest thing is what's the force that causes them. So if it's a major car accident or major injury, then I'm not too concerned about getting them back in activity. But if they develop a concussion just from a little blow to the head, then I'm more concerned about them getting back.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.